Hello students. Today we will start with the objective in epidemiology of infectious disease, which is disease prevention and control measures. In the last two lectures we have seen sources and reservoirs of infection, modes of transmission. Now disease prevention and control measures. So let's begin. Disease prevention is a procedure through which individuals, those with risk factors for a disease or without the risk factors, are treated in order to prevent a disease from occurring. Treatment normally begins either before signs and symptoms of the disease occur or shortly thereafter. Okay? Prevention includes a wide range of activities known as interventions aimed at reducing risk or threats to the health. Fine. It can include patient education, lifestyle modifications, and drugs. Medication. Now let's see. 3 prevention steps: primary, secondary, tertiary. Okay? Primary prevention. Control aimed at reducing the incidence of infectious disease or their risk factors can be considered as primary prevention of infectious disease. Fine. It protects health through individual and community-wide measures, including such actions as maintaining good nutritional status, keeping physically fit, immunizing against infectious diseases, providing safe water, and ensuring the proper disposal of feces. Fine. Next is secondary prevention. Control aimed at reducing the prevalence by shortening the duration of infectious disease can be considered as secondary prevention of infectious disease. Okay? Secondary prevention corrects departures from good health through individual and community-wide measures, including such as actions, screening that results in early detection of disease, prompt antibiotic treatment, and ensuring adequate nutrition. Fine. For example, prompt and specific drug therapy for tuberculosis. Patients resulting in sputum conversion to culture negative status renders them no longer a source of infection. Next example is treatment of HIV positive pregnant women, which reduces transmission of HIV to their newborns. Fine. Next, tertiary prevention. Control aimed at reducing or even eliminating long-term impairments of infectious disease can be considered as tertiary prevention of infectious disease. Fine. It eliminates disabilities, minimizes suffering, and promotes adjustment to permanent disabilities through such as actions which provides orthopedic appliances and its associated rehabilitation for victims of poliomyelitis, counseling and vocational training, and prevention of opportunistic infections. Fine. Example: the prevention of opportunistic infections in HIV infection can be considered as tertiary prevention. Fine. Approaches to disease prevention. Now there are not two approaches. Okay. One is high risk approach, second is population approach. Okay. A whole population, whether they are exposed to risk factors or not, or tackling only those identified as being high risk, are included. Now there are some positive and negatives towards each approach. Let's see. High risk approach. High risk groups can be identified through screening, genetic testing, analytical studies, linking risk factors and disease, and ecological studies to identify these groups. Now, what are advantages in this approach? It may be more cost effective than population-wide approaches. Those who are identified as being high risk may be more motivated to change their behavior than the whole of society. Third, easier for health professionals to promote change on an individual basis. Fourth, individuals are usually aware of their exposure to adverse risk, whereas in society, not everyone will have been exposed. Fifth, society prefers focusing on individuals to change rather than a whole population. Fine, these are the advantages of high risk approach. Disadvantages: it can be expensive. Next, it can fail to address public health problems. Next, it ignores the point that a large number of people exposed to a small risk may generate more cases than a small number of people exposed to large risk. Next, it tends to medicalize prevention. Next, strategies for the individual tend to be either palliative or temporary. Next, does not focus on what influences behavior. Next, does not tend to predict an individual's change in risk and may have a little overall impact on the control of disease. Understood? Notice population approach. Now here we can directly understand through advantages that it recognizes that society influences individual behavior. Risk reduction can be achieved at population rather than individual level. Next, in situations where there is a dose-response relationship in terms of risk and exposure, shifting the entire population distribution towards lower levels of exposure. Fine. Now, disadvantage: less effective in situation where there is not a dose-response relationship in terms of risk and exposure. Okay? Understood? Now, students, in this whole epidemiology part, if you have any doubt, any confusion, you can please ask me. Okay? Thank you.